how would I identify myself? I'm laughing because I'm looking at Dr. Al-Mateen, and we are both cultural psychiatrists, and so there's a lot that goes into what we think of in terms of our identity. So I will say my professional identity is that I'm a triple board trained physician. So I'm trained as a pediatrician in adult and child and adolescent psychiatrist. And there's a lot of academic work that is meaningful to me. I love working in training and in education, and I love really kind of the idea of behavioral health and mental health care education on a broad spectrum. I'm a very proud member of ACAPS, so the American Academy of Child and Adolescent Psychiatry's Diversity and Culture Committee. It's really where I found a professional home. And in fact, one of my strongest mentors is Dr. Al-Mateen, who is interviewing me right now. And I think there's a lot of elements of diversity and culture work that are kind of strong in terms of my identity. So then that pulls me into my personal identity, and I'll leave out some of those professional elements. So I am the daughter of immigrants, and my parents are professionals from Pakistan. My mom is a pediatrician trained in social pediatrics, so a little bit of working with kids, and she worked at a federally qualified health center in the Bronx, New York City. So working with kids, especially from underprivileged backgrounds and from different socioeconomic statuses and of all sorts of different races and cultures is in my blood. My parents are both from Pakistan. I also identify as someone who is Muslim. I'm visibly Muslim. I wear a hijab. I am cisgendered, heterosexual. I'm recently married. So now I've become a wife, which is a big part of my new identity, and otherwise a sister and a very proud aunt. These are some of the things that I identify as. I think for a long time, I didn't want to be exactly like my mom, but I somehow followed her footsteps in terms of choosing medicine and then realizing I really loved working with children. And this is where I actually thought I was going to go into pediatrics up until there was a sub-I where I took very long social histories, and someone said, "Hey, why don't you think about doing an elective in child and adolescent psychiatry?" And I was like, okay. And I did, and I loved it. I didn't want to let go of pediatrics. And in my head, I was like, I wanted to be trained in both. The duality of the training, really understanding people from both the mental as well as physical health was really important to me. And so I kind of co-applied from pediatrics and as well as into triple board programs. And I ended up thankfully matching into a triple board program at the university at UPMC. And so that led me to my triple board training, and now here I am, child psychiatrist. So I'd say ACAP is the big one, and kind of in addition to being a part of the Diversity and Culture Committee, I'm also on the triple board and post-pediatric portal program committee. That's kind of the main professional organization. I will say I am trying to be more involved both in the American Academy of Pediatrics, the AAP, as well as the APA, the American Psychiatric Association. And I'm currently the assistant program director of CHOP's post-pediatric portal program. And so I'm involved in the Psychiatry Training Director Conference, or ADPERT. So in terms of the portal program, there are a couple of different ways for someone to be boarded both in or board eligible in both pediatrics as well as adult and child psychiatry. The old-fashioned way of doing it is literally to do two separate training programs, to do a full either, peds or adult and child psych, and then do the other. And then there's some ways to combine that training. So obviously the triple board is a 5-year combination where you break that down into 24 months of pediatrics, 18 months of adult psychiatry, 18 months of child and adolescent psychiatry. And at the end, you're board eligible for all three. And the post-pediatric portal program kind of looks at people who have done pediatrics and are either finishing residency or, in fact, practicing trained pediatricians, and realize that really the next point of their professional career requires them to have formal training in adult and child psychiatry. So it's a 3-year fellowship program. Again, it's 18 months of adult psychiatry and 18 months of child and adolescent psychiatry.
Okay.
And so you're board eligible in both of them after completion of the 3-year fellowship. There's a lot of stories that we very humbly receive. And I'd say I mostly work on a consult liaison as well as emergency room settings. So the bread and butter of my work is seeing, kids who are suicidal. And I think just listening to those stories is, pretty awe-inspiring in terms of learning about what people are going through and what's bothering them. I'll share a lighter story for for the sake of this interview. And we got a consult for someone who was having some psychosomatic symptoms to kind of determine the etiology. It was a child who had some neurologic background, and she actually had an abnormal finding on an MRI, such that neurosurgery was also consulted. And so they weren't sure if she would need neurosurgical intervention. And in a very quick interview, it was very apparent to me and my trainee that she had a lot of anxiety. And in fact, some of her unexplained symptoms were in fact anxiety, and not even a conversion disorder. And I remember being able to do this evaluation and reassure this, I think she was like a 9 or 10-year-old girl, that what I thought she had was anxiety. And she just looks at me and she's like, "That's it?" And I was like, "That's it." And she's like, "I don't need neurosurgery." And I was like, "Not for this, you don't." And then she's like, "Well, thanks, doc." And I said, "You're welcome." And then we left the room. They didn't have any other questions. And I was just doing some, training with my trainee afterwards, right outside of the room. And the mom came out literally maybe a minute or two later, crying and just saying, "Thank you so much." She is so relieved that there's not anything more wrong with her. She's so excited because she thinks she, really has needed therapy for a while, but wasn't sure how to ask for it. And she's really just so relieved that this is it. Like, we can't thank you enough. And this was pre-COVID times, but she kind of gave me a hug and I received it. And it was just really wonderful to bring this little moment of joy and reassurance into their lives, and also to create a safe space for this young child to share the different things that were bothering her, and really to name some of that, or provide insight into, what that emotional experience was that was leading to some of these physical symptoms. And obviously it was very reassuring to the family that they did not need to follow with neurosurgery, and in fact, even neurology going forward for the symptoms that brought them in. I mean, I'm obviously in this field and I love it. And so I think there's a variety of elements that I really love about this field. And it comes down to, my job is to kind of sit and be with people as they're struggling and really listen to them, try to understand them, and then help be a partner with them in terms of how to help them going forward. And I can do that for kids and adolescents, oftentimes people who don't have either other adults or other reliable adults in their life to talk to, or kids who are so ill with depression and anxiety that they feel so overridden with guilt, they're not able to outreach the adults who do care about them and are there. And I think that's just one of the best things, like one of the best feelings in the world, is to think that you're helping a child or adolescent through a really dark time. You're literally naming it for them. You're providing psychoeducation in terms of all of the other psychomotor symptoms that go along with, low mood or anxiety. You're giving them a relief just in terms of like, oh, this isn't normal, right? Every depressed kid just thinks what they're feeling is normal. And you're like, no, you're not feeling normal. You're feeling ill and depressed. And being able to name that for them and give them some hope for the future, and then be along with them for that journey, is really a beautiful experience. And I'm like very lucky and honored to be able to do that as a job. I think to think about this question in a couple of different ways. So the first that comes into mind is, what made it harder for me as someone in training, or even now as, an attending psychiatrist. And, as I mentioned earlier, like, I am a person of color. At the same time, I come from a very privileged background where my parents are very well educated. My mom is a physician. And so, I'm well educated and luckily have, some university backgrounds that give me some clout. At the same time, I think there were certainly a time during my training where, my abilities as a physician were brought into doubt just when people looked at me. So, as a senior resident, I had a mother who looked at me and just was like, "I don't want a Muslim doctor." Right. No, nothing to do with how I was providing care or my background, my educational background, or literally my abilities. But she just looked at me and just stated that as a fact. And being able to navigate that was certainly a challenge. Like, it was very hard for me to think, despite all of my professional accomplishments or academic achievements, right, that's not what someone is judging me on. I also had, attendings I worked with as a trainee I had an attending once who looked at me and was like, "Oh, do you know how to use Google Scholar?" And like, why he thought I didn't know how to do that. He also thought I didn't know what PubMed was. And it's very striking to me where, I was singled out as the person on a very large team. I was not the only resident. I was not the only trainee on this service who was asked these questions. Um, and it forced me to have to prove myself in a way that some of the other trainees didn't have to. And so I think that was also a challenge for me. And then I think, we describe these as, microaggressions, if not frank macroaggressions or bias that happen in the workplace. At the same time, you still have to, show a good front and be a very good doctor. And in some ways, a better doctor because people are expecting less from you, or because people will catch you if you've done something wrong, where you think, some of that might be a little bit excused by someone who doesn't look so obviously different, whether by the color of your skin or also, in my sake, I wear the headscarf. So I think that's one way to think about your question. I think the more I'm in practice, the other way I think about it is, we are all biased in some way, and, that's okay to acknowledge. I always think about, what do the people who I, have the honor of meeting and serving, what are they thinking when, I pop up from a visit? Are they looking at me and thinking, oh, will she understand me? Will she understand my experience? What is kind of going through their mind? And really, I think my job is to kind of create a safe space for people to share their stories, their experiences, because it's their narrative understanding of their symptoms and their problems that I'm really trying to understand. So it's my job a little bit, I think, to navigate what they may think about me or what assumptions I may have about them to make them more comfortable, say during, a psychiatric interview or a therapeutic session. And I think the great thing about working with kids and adolescents is they much prefer if you're a little bit blunt and open and honest about things. So I never pretend to know about something if I don't actually. If they're bringing up a topic, I'm like, I'm sorry, I don't know what that, whatever it is. Or, if they're identifying in a certain way, I will just say, thank you for sharing that with me. I don't have enough information. I'm happy to Google that later, but if you want to tell me a little bit more now, I'm happy to hear about it. Or, sometimes even I acknowledge in the room, like, I'm asking you some really tough questions or some really personal questions, and I'm a stranger. This must be pretty tough for you. Do you even understand why I'm asking you these very intensely personal questions? And a lot of times they're like, no, why are you getting all up in my grill? And I said, I am getting up in your grill. Here's why. I'm looking to understand you better because and I have cheesy goals as a psychiatrist, but one is to keep you alive. Two is to make you happier now than you are, to make you happier in the future than you are now. And so getting to know you helps me do that. And so I think pausing and kind of explaining what I'm doing or what's going on and really explaining what I don't know can be very helpful in creating that safe space for them. And that way, I'm not pretending. They see I'm not pretending. They see I'm authentically trying to get to know them. And every question I ask is for that reason, right? Like sometimes I can just say, listen, this isn't pertinent to the psychiatric interview. I'm just curious. And I'll ask them something. And I think that's they don't have to answer that question. But it's at least me getting to know them versus if I need something else, I'll explain how come that's important. What supported me and kind of helped me to get to where I am and hopefully beyond this. I think, medical education is rough. There's a lot that goes into it. And I think there's, literal support that goes into the beginnings of it, where without my family and my parents, I would certainly never be here. If they never given me the time and the opportunity and the encouragement to be studious, I couldn't be here. They literally helped me eat and drink and sleep during training, right? And so that was huge. And having people do some of those things for you. I think I also had a tremendous amount of support in terms of my, my co-residents. There were so many faculty members, both on the pediatric side and the adult and child psychiatry side during my training that were just supreme mentors. And if, me being able to kind of share some of these stories or share some of the hard times and get immediate emotional support and professional support in terms of, if you want help navigating this problem, or if you just want to vent to us, or if I can just buy you a coffee and listen to you. And, I had a tremendous amount of that going forward. And I think it's really part of why I found a home in our diversity and culture committee, because there's so many people with, such incredible stories who are just wanting to be mentors as well as mentees. And there's just like a shared love that we have for the field, but also each other, and really propping each other up. And I will point you out in terms of, I think you have been one of my greatest really professional mentors, even in terms of guiding me towards projects or to take something that was just kind of a personal value of mine and turn it into like some professional work that I'm really proud of. So I thank you as well as all the mentors along the way. I was reminiscing with a friend who is in a different field of medicine, but I will say it's a surgical subspecialty. And I think a difference between her and I is that in my professional work, I think a lot of my personal values have a home and they can shine, whereas she kind of has to hide some of her personal values in her professional work. So, for example, a lot of the personal causes that I feel very passionate about, I can kind of espouse in my professional work. Again, like I think being a great child and adolescent psychiatrist comes to you intentionally getting to know a kid and their family and really trying your best to understand what's going on in their life and how to make it just a little bit better and how to keep them safe. And I think that's, a really kind of humble and beautiful thing. And in so doing, you're also learning about a lot of different, systems. So you're learning about how they're doing at school, how, the education system, or sometimes the juvenile justice system, or sometimes the other systems that kind of try to help support kids are either working or how they're not quite meeting the needs of certain patients or families. And you're doing your best to kind of get them the resources that they need to help this kid just do better than they're doing right now, whether it's like, treating their suicidality, whether it's, helping them be less anxious, whether it's treating their psychotic symptoms, whatever it is, you're really kind of reaching out to them to see them to do better. And I love that. Like I'm literally helping people stay alive and better their lives. I think it's a very honorable way to spend my working days. A lot of it is thinking about, the experiences I've had where people have either judged me or made assumptions about me, whether because I'm a woman or, I'm Pakistani or I'm Muslim or, who knows what have you, has kind of affected my, ability to try very hard not to make assumptions about other people, but to really, ask them about themselves. I would say the other part of my life that I think has the biggest impact in, how I treat patients is I was once hospitalized for a kind of fluke medical emergency. And being on the other end, like being a patient for, a week in the ICU was very eye-opening, and just seeing people kind of rush in and out, and like people I didn't know ask me very personal questions, or, sometimes I had staff who got things wrong. Like I had a staff who brought me a meal and I was like, I'm NPO right now. And, having to correct them. And, that really taught me what it's like to be on the patient side. And so now as a provider, I'm like, wow, there's strangers just walking into this room. You don't know who they are, even if they identify themselves, they're using terms that you don't understand. This is, and I think it's especially true for, either minority patients and or families that are, don't speak English as a first language. Like they don't understand the culture. They don't understand the 17 people that walk into a room and what their different roles are, but why everyone is asking either similar questions or something along those lines. So I think it's helped me kind of navigate what the patient experience is like a little bit more, because I always think about my own patient experience. And I was like, man, that really stank when X, Y, or Z happened. I'm going to try not to recreate that and, try to really make it more patient and family focused. So I majored in folklore and mythology, which
Okay.
which at the time I was just like, I loved reading fairy tales, and the idea of folklore seemed very interesting. I will say we didn't have a medical anthropology major, otherwise it's probably something that I would have thought of. But again, I've always been interested in how come people do or make the decisions that they do. And in this case, I ended up writing a thesis about, are you ready? The folk medical practices of Los Moriscos, so the Muslims who were forced to convert to Catholicism in early modern or 16th century Spain. And what was fascinating about this is it's a combination of two different, groups in terms of two different religious identities. So a lot of their folk medical practices had some Catholic influence, but also some Islamic influence. They also had influences from like traditional Spanish tradition and Arab tradition, because that's where a lot of their heritage was from. And so how the different influences affected literally their belief system about medical care. It's funny because now I say this and I'm like, obviously I'm a cultural psychiatrist. Clearly,
Right?
but I went
Well,
to college, right? I had no idea that this is where I was headed, but I think I've always been interested in the different influences on a person's life and how that leads them to make, in this case, medical decisions. You've helped me get involved in more, I would say, cultural psychiatry academic work. So in terms of looking at the literature and you're trying to see, where's there room to add to the literature, or where is there room to teach about this? And so thanks to you, I've worked on a couple of different projects. And I will say that is also really a part of the teaching that I think is, very in line with what child and adolescent psychiatrists do. Like, I think every psychiatric interview, we're teaching our patients what is depression, what is anxiety, what is, whatever it is that we're evaluating them for. And it goes with, trainees, we're teaching them what's going on. And I think we're helping people understand, their own cultural identity. So everyone has a cultural identity, but has everyone explored it? And it's constantly changing. Like, even, I'm in my mid 30s and it's very much evolving in terms of who I am and, what means, what has more value to me, and being able to kind of teach that to trainees to ask, as well as to the kids and the families we see, I think helps them so much and provides sometimes a lot of insight that they didn't realize they were having, or provides a lot of insight for them that they, didn't even realize was ongoing. So I think that's another cool part of child psychiatry, where literally sometimes even the questions you ask can be therapeutic, and being able to kind of sit there with those questions, and especially some of the cultural questions and the identity questions that are, identity formation is a normal part of adolescence, and yet we don't always think about it or talk about it in that way. It's just very lovely. And I think it's interesting whenever I teach about culture, a lot of people feel like, it's the elephant in the room. They don't know how to talk about it. And I think that's fascinating, because I'm like, you've literally mastered asking people if they've tried to kill themselves. That seems a lot harder than asking, hey, do you belong to a religious group? Or are there, racial groups that you identify with, or, something along those lines? But it's because I'm in practice of, being more comfortable with that. But, these are topics that I think societally we kind of are like, oh, we're not supposed to talk about this at Thanksgiving dinner. And so we tend to shy away from it. But by sometimes literally empowering, whether it's trainees to ask the questions during psychiatric interviews, or even empowering kids and families to think about some of these issues, you can kind of help understand what's going on. But for them, like, that insight in and of itself may provide some, happy outcomes. Just the fact that they're starting to think about this and kind of explore that identity. So I think that's a pretty cool thing that we get to do in our professional lives.